Hello, my name is Dr. Petra Deeter. Thank you so much for the opportunity to talk to you today. And so I have some notes. So I want to make sure that I don't miss what I wanted to share with you. So today I'm going to talk to you about parental alienation, its long-term impact on children, why it is child psychological abuse, and how it is a very widespread problem, and it's very counterintuitive, and that's why it needs very specialized knowledge in this field, and that's why there's a need to improve guardian ad litem training. Okay, so let's go into these points. Now, what's parental alienation? Now, if you are not familiar with what parental alienation is, it's essentially what happen when one parent, usually a parent, but sometimes it could be somebody else, like a step parent or someone else, who influences a child and prevent the child from having a relationship with the other parent. This usually happens after a divorce or a separation, but it doesn't have to be. Now, this could be in the form of bad mouthing, like saying things like, you know, your your dad is abusive, for example, or your mom cheated on me, or your dad doesn't pay child support, or your mom is so emotionally unstable. Things that are really inappropriate for children to hear, and at the same time putting the children in the middle of adult conflict, using the child as a weapon to harm their ex-partner, their ex-spouse. Now, there have been many fields of studies that sort of colliding and coinciding that show that parental alienation has both short and long-term impact on children. So, for example, there's a very long range and wide, very big study by the CDC that focus on, it's called the ACE study, like adverse childhood experience, right? So one of the aspects of adverse childhood experience is if a child losing a relationship with one of their parents, for example. So there's that study, and then there's also other studies, for example, studies on divorce, looking at parental conflict and separation. There's studies on child development, looking at attachment theory, the disruption and impaired attachment relationship. There's study on trauma, looking at interpersonal trauma and developmental trauma. So there's this different field of studies that not even related to parental alienation, together with the research in parental alienation itself, they all intersect and show that a child in this situation suffer from both psychological impact in the short and the long term, but the psychological impact also manifests into physical condition, including, for example, cognitive impairment that lead to health risk behaviors and lead to diseases, illnesses, and early death, things like that. So it has a very serious impact, and this is also a very widespread problem. There have been studies, for example, a study from Colorado State University that shows that in the US alone, there are over 22 million parents who are victims of parental alienation. And if you're looking at each parent has at least one child, so the number of the children that are suffer from parental alienation is actually really large. And there are 3 times the number of children that are moderately to severely influenced or impacted by parental alienation than the number of children with autism. Yet you don't usually hear about parental alienation a lot. People are familiar with autism, but if you talk about parental alienation, not many people are familiar with that term. So there is really a lack of awareness in general, and not just in the general public, but even in professionals like guardian ad litem and even mental health professionals. And so I wanted to talk about why this problem is. I'm going to just talk about a few of the things that show that this problem is very counterintuitive. Not all of it, but I'm not going to talk about all the. It's actually not possible to talk about all the factors why it's counterintuitive, but I'm going to at least cover a number of examples why this problem is counterintuitive. And in general, you just think about psychological abuse. because of the lack of bruises or screaming, for example, it's harder for people to acknowledge or notice or identify. So that in itself, you already know that this is a challenging problem, because it's usually a form of manipulation of the child's mind, right? Corruption of the child mind. So it's harder for other people to recognize this. So let's talk about these different factors that show why it's counterintuitive. So one is it's very counter instinctual for a child to reject a parent. So unless if there was an outside influence in some way, it's very rare and unusual for a child to reject a parent, even if a parent is abusive. So there have been studies, for example, looking at abused children that are in foster cares, for example, right? Even though they have been proven they are abused children, they've been abused by their parents, and these children being removed from their parents and put into foster cares, you still see that these children wanting to long for their parents, still want to return to their parents, still looking for approval and still wanting to protect the children. So you can see that children don't usually reject a parent. So when a child resists a relationship, resist or reject a relationship with a parent, it's usually due to some kind of outside influence. Another thing is there are situations where a child refuses a relationship with a parent due to either abuse or estrangement, right? Like let's say a parent abandoned a child. That child doesn't look the same as an alienated child. They only look similar in a superficial way. So in order to identify a child that is truly alienated versus a child that rejects a parent for the right reason, you need special knowledge into that. And I'll talk about that a bit more later on. So that aspect of it. Now, another thing is when you're looking at a situation like a parental alienation situation, the abuser is a parent usually, and unfortunately, you're looking at an abuser that is often someone that looked like an outstanding parent, because these are people that have some, usually in the form of a personality disorder. So they know how to come across charming, they know how to say the right thing, they know how to manipulate people, they know how to and then also because they are in the attack mode, right? Because they are winning, they are able to, manipulate the child, so they feel like they are in the winning mode because they are able to destroy their ex-partner, like harm their ex-partner, hurt their ex-partner in a very painful way. So they actually come across very calm and confident, and so things like that. So then for someone who is not truly experienced in this field, looking at the two parents, you can get confused. You can think that this person that come across as calm and confident and an outstanding parent, in fact, that could be actually the abuser, versus the other parent who has been suffer from this painful loss of their child that they love so much, and seeing the child suffer from this psychological abuse, and they are helpless, not being able to protect their child. So they can come across like emotionally distraught and full of trauma, that you can think that this parent is not a good parent, because you can misjudge that, right? So unless you have the right kind of training and knowledge and be able to identify these sort of behaviors, you could be misguided in this situation. Another way that people don't realize is that traditional therapy doesn't work in parental alienation, and I will give you a reason, just one of the reasons why traditional therapy doesn't work. Is, for example, traditional therapy, it was built in a way that the therapist or the psychologist were trained as the advocate for their patient, and their advocacy is in a way of empowerment, right? So the normal traditional therapy is by listening, right? So you let the person talk, and then you provide treatment by agreeing or supportive, right? Saying, oh yeah, you're right, and yes, poor you, poor thing, you couldn't help it, and um, let's make you feel more powerful, right? So that's the traditional therapy. Now, if you put this into a situation where a child has been brainwashed, programmed to disrespect one parent for the wrong reason, and treating them very cold and rude, and rejecting a relationship with that parent. Now, this child has been brainwashed, so the voice that you're hearing from the child is not in the child's best interest. So if you have someone that follow the traditional therapy and not recognizing that this is a child that has been brainwashed, and you sit there and you listen to the child, and you apply the same way of therapy of saying, oh yeah, you're right, yeah, you should be in power, what you're doing is you actually push the child to be further and more alienated, which is very dangerous situation. So that's why it's very important to recognize. So people tend to, especially guardian at Litem, right, because their role is to advocate for the child. So they need to be able to understand that best interest of the child may not be what the child say. So there's a difference between best interest of the child and the voice of the child. Because when you are hearing the child, it's actually not the true voice of the child. An alienated child is speaking the alienator's voice, right? They speaking, there's a pathological enmeshment between the child and the abuser, which is the alienator in this situation. The alienator has been bad mouthing and brainwashing the child about the other parent. So the voice that you're hearing through the child is actually the alienator's voice. So being an advocate for an alienated child doesn't mean that you follow what the child wishes. So recognizing the best interest of the child may not be what you hear from the child is very important. And so you need to be able to identify correctly whether this is an alienated child or whether this is a different situation that you would normally see where a child may have been abused by this parent that the child rejects. Right? So it's really important. And then the other thing also is that very often people will go, if a child is 15, 16, 17 years old, for example, right? They say, well, I guess there's no more incentive to try to intervene now. Now, this is so wrong because when you look at, there have been studies that show that psychological abuse is just as damaging as sexual or physical abuse. Now, if you go into a situation where a child is sexually abused, do you go in and say, well, this child's 16, we'll just leave the child there and we won't intervene and we won't do anything about it because the child's already 16? Like, we don't do that to sexually abused child or physically abused child. Why are we doing that to a child that is psychological abuse? Right? So that's really important to recognize. And another way of looking at it is actually to recognize that while this child is very close to 18, that means that it's actually even more urgent because very soon the system will not be able to go in and help this child. And this child will now go out of the system without any help, and then that will leave them damaged for the rest of their lives. So if anything, you should actually look at that as an urgent case of the need to fix this situation. And there's also this misconception that a child that is older may not or cannot be compelled to follow the order and be able to get fixed, for example, go get the right treatment. That's actually a misconception. There have been studies, there have been cases that show that clearly the child can be shown or compelled to follow the court order and things like that. Okay. And then the other thing is, another counterintuitive thing is that sometimes people will look at a child and say, look at that, the child is well behaved, the child is doing well at school. Now, those things are not an indicator of how well the child is psychologically and emotionally. So just because the child is doing well at school doesn't mean the child is hurt or broken inside or damaged inside. So these are the things that show that parental alienation is a very specialized, is very specific thing that very highly counterintuitive, and at the same time, it's a very serious, very damaging situation, and it's a very widespread situation. And so there's the need for training for all the professionals, including particularly guardian ad litem, somebody that working so closely with the children that have such a power in making recommendations to the court regarding, what's going to happen to this child. This is actually the most important place that we can help by having the right training and the right awareness for these people. Okay, so I have talked to you about what parental alienation is. I mean, these are just very quick highlight because I don't want to take too long of your time, but and I have so much more. I'm not available right now, but I know you're watching through the video, so I can't answer questions right now, but feel free to reach out later if you want. I have so much more information. I have so much research out there. There's peer-reviewed publication. I have so much data. I have cases if you wanted to talk to specific people, things like that. I'm happy to provide so much more information. But I have already talked to you about what parental alienation is, why it is damaging to children, both short-term and long-term, and why it is a form of child psychological abuse, that it is a widespread problem. When you're looking at something that is severe and it's widespread, you are looking at a public health crisis. So it definitely needs intervention. Now, having the 50-50 parenting is definitely helpful. It's a one important step in this, but we need more than that. So it's really important. And when you're looking at such a large number of children that are going to suffer for the long time, you are not just looking at this individual social attainment and life satisfaction, things like that. You're also looking at other society costs from like this illness and support system that these individuals are going to need, and also the fact that they are not going to be fully functional or fully contributing members to the society. So you're looking at not just individual personal costs, but you're also looking at society costs. So really, this is a problem. This is a system issues that need to be fixed. Okay, so we talk about what parental alienation is, that it's damaging, that it's widespread, that it is counterintuitive, that so there's a need for professional to get training that specialize into it. So I won't go into a lot of details in terms of the actually what's needed, but I will highlight a few things. And even if you need help with developing programs, I'm happy to come in and help with that as well. But there are a few things that should be included and important in the training for professionals that dealing with situation that dealing with family dynamics. So for example, there are forensic tools to identify and correctly diagnose parental alienation. And one of those tools is called the 5-factor model. So the 5-factor model is a very comprehensive model that looking at all the parties involved in a situation, both parents and the child. So looking at the past as well as the present and the potential future. So that's a very good model. It's a forensic model in order to diagnose parental alienation. So that's an important piece in the training that should be in the training for guardian ad litem, for example. Another aspect of it is child suggestibility. So there have been a lot of in-depth research into this, and if you're not familiar with it, the first time that you learn about this, it can be very shocking to see how easily it is for a person, doesn't have to be a child, can be an adult, how easily it is for someone to be manipulated and to create distorted or false memory. You can plant completely new false memory in someone, or you can distort their memory. So, and then the aspect of child suggestibility. So, for example, when you interview a child and you ask a question in a certain way, it can mislead the child into a completely wrong direction. So having the right training and understanding in these aspects is really important for guardian ad litem. Another aspect is children critical thinking. Now, when a child has strong critical thinking skill, then it's sort of like a tool, or it's like the muscle that help the child from less impacted from parental alienation, or less likely to be influenced by parental alienation effort, for example. And then also empathy, communication, things like that. So these are a few different things that should be added into the guardian ad litem training. There are more, but at least these few things that I mentioned. So those are the aspect about guardian ad litem training. I wanted to add another piece that not exactly to do with the training, but to do with, I guess, system reform, is that when you look into the system, you may notice that guardian ad litem, or actually all the professionals involved, are getting paid by the billable hours, right? So the system actually incentivizes these professionals the wrong way, meaning that the longer they drag the case out, the more they're going to get paid. So the system doesn't incentivize a quick solution. So there's less incentive for this professional to fix the problem or treat the child or whatever it is, right? So the system incentive way of incentivize professional, we need to rethink that. We need to figure out how to reform this, because this is not in the best interest of the child. So anyway, thank you so much. These are just a few points that I wanted to highlight. I'm happy to come back and talk to you a lot more in depth into any aspect of this, or even more than this. And I'm happy to help with any programs that you need. So thank you so much. And I look forward to hear any feedback or any questions that you have.